Now, Duchenne's muscular dystrophy, what is except? आपका pure guess and luck. बोलो. Somebody saying tongue. Hussein, your authority. What is your answer? Huh? Tongue. According to Hussein. Nafis?
I have written it tongue, sir.
Tongue is Nafis better. A. Sternal head of the pectoralis major. Any other answer? Yes, doctor. Glutei. कोई deltoid बोलो जल्दी. Huh? Excellent. Sternal head of the pectoralis major. Except that the Duchenne's muscular dystrophy can involve gluteals, deltoid, masseter, as well as the calves. All of them can be involved. Race is an example of fundamental definition. Secondary mitochondrial hepatopathy is what you need to basically remember. Very good. Wilms tumor, what is except? Fatafat bol answers.
Prognatism. Deprognatism.
You mean to say prognatism is not there? That's right. Hemihypertrophy is all the part. Persistent hypertension is not due to? Wrong answer. People will be happy.
B.
Huh?
B.
Chronic pyelonephritis?
Sir, because
D. D for doctor.
I have written it B, sir. I thought it is tubular nephritis.
Pyelonephritis can occur because of any urethral, post-urethral valves and all these things can lead to in pediatric population. That can in turn lead to reflux nephropathy. That can lead to hypertension. Any other? Essential hypertension is very rare phenomena in children. Most common cause of hypertension is renal hypertension, which is secondary. That is renal parenchymal.
Sir, can tubulointerstitial disease cause hypertension?
Very much. I mean, in the sense,
tubulointerstitial nephritis, can it cause hypertension?
The point is, if it is a salt losing type, because the tubular dysfunction,
so no hypertension,
then that is a protective factor against the development of hypertension. Yes. Now, which is not a condition of micro but a macrocephaly? Alexander has a big head. Alexander. Lissencephaly means, what is the definition? Scaphocephaly, lissencephaly. Excellent. Gyri sulci will be missing in the brain. That is lissencephaly. Pyogenic meningitis may sensory neural deafness most commonly. What is your answer? You want to say H influenza, but nowadays newborn paida hote hi hip vaccine. All possible vaccines we are injecting, no? Left and right. One anti-MD entrance failure vaccine. Future में doctor हो गया है तो stem cell transplantation vaccine, so that if he forgets the MD entrance high yield facts, once more एक stem cell डाल सकते next year. So pneumococcal meningitis currently is the most common cause. Only two organisms, Neisseria meningitidis and pneumococcal became the continuing causes. New ORS of WHO. What is the correct ingredient? A. Ramkrishna. You need to pronounce other answers at least. That's important. So new ORS may you have 75 sodium, potassium 20, chloride 65, citrate 10, glucose 75. Dr. Murli Bharadwaj cooking classes. क्या कितना डाले तो रसगुल्ला बना सकते. So you need to be quite sure. Now doctor. Wide and variable splitting of the second heart sound except MR. How many want to say MR? This question I will explain. Because general medicine I can explain extempore also. Remaining things I need to prepare and come. See doctor, aortic sound first, followed by pulmonic sound. Any early closure of the aortic valve or a delayed closure of the pulmonic valve will widen the split. You agree with me? अगर MR है तो क्या होता? When ventricle is contracting, some blood is going forward, some blood is going पीछे जा रहे. तो will aortic valve close early or late? Early. काम जल्दी खत्म हो गया ना. Half the night duty you did, other half your fiancé did. So ultimately all patients are killed thoroughly in the night very early. So early closure of A2 that lead to widening. So MR lead to very much the widening. Okay, what is the alternative answer? Pulmonic stenosis, there is a delayed pulmonic valve that also will widen. Tetralogy of Fallot में क्या होता? There is no aortic component only. Sorry, pulmonic component only, single heart zone. So that is the reason it does not lead to widening. Rather it is heard as a single sound. So that's the reason TOF is the answer. Now doctor, elevated creatinine kinase is found in, what is your answer? Dermatomyositis. Very good. In fact, how will your patient of dermatomyositis and polymyositis will come to you? Inability to get up from a squatting position, proximal muscle weakness will be there. When she came to you, heliotrope rash is very characteristically present. What is the decision you need to take at that point to treat her? To give steroids. But what is the worry that is there in your mind? Steroids themselves also can lead to myopathy. Themselves also can lead to myopathy. If you wrongly fire your diagnosis, you can worsen myopathy in fact, if it is not dermatomyositis. So how will you know for sure that this proximal muscle weakness is due to dermatomyositis in this lady who has a difficulty to get up from a squatting position with a proximal muscle weakness with a patients may or may not have heliotrope rash. If it is there, good. Even if it is there, you may not recognize. Maybe she is your first case. How will you conclude? Send her blood sample to laboratory. If the laboratory will report high CPK levels, no second thought, start steroids. Okay, doctor? So high CPK levels is a characteristic feature in a proximal muscle weakness. If a woman presents to you, to confirm that it is a case of dermatomyositis is what need to be remembered. Lepromin test, where is it highly positive, doctor?
Tuberculade.
Super. That should be the regular आवाज of the correct answers or even wrong answers. इसलिए mic दिया. Ram Krishna. Lischke nodules, what is your answer? Sing along the answer. Huh?
B.
Neurofibromatosis. सबकॉर्नियल पुस्चुलर डर्मेटोसिस में व्हाट इज द ट्रीटमेंट? पहली बार सुना सर, फिर भी कोशिश करेंगे. हाँ, सुपर. Dapsone. Langerhans cells are important for what? Huh?
Healing, sir.
Healing of the wound.
Sir, it is antigen presenting cell, no sir?
It is?
It is antigen presenting cell.
Okay.
So sensitization.
What is contact sensitization? So basically Langerhans cells are a specialized epidermal macrophage. They initiate basically the wound healing via production of nitric oxide and epidermal growth factor is the point of interest. What is true about nasal airway? Oropharyngeal airway, nasal airway, two airways you know, no? हाँ जल्दी बोलो. एक राइल ट्यूब और दूसरा oropharyngeal tube. What is your answer? It is less better tolerated. Who wants something poking into the nose? Mouth is more tolerate anything that goes into it, not the nose that easily. But still it is better tolerated than oral airway. Okay, agreeable. That logic doesn't work. Now, A comatose patient can very much tolerate what goes into the mouth rather than into the nose. That means. Now, what is except about nitrous oxide? It has a low blood solubility.
Fast acting.
Low blood solubility. Now, non-depolarizing agent except, अगर ये क्वेश्चन भी wrong करे तो poor prognosis in anesthesia. Next, subgeral choline induced hyperkalemia, very standard digested question. Obesity is not indicated, but trauma, spinal cord injury, burns, they are all implicated. Post-dural puncture headache, what is except? Definitely it is related to, what is the special type of needle we use called Whitaker's needle. Recent entrance also, AIMS November May, there was a question on the post-dural puncture headache.
Size.
Any entrance you go, ultimately issues will be same, doctor. What is the number you want, remember? 25 gauge, not more than that, is very important. And what type of needle? Pencil point needle, like Whitaker, is what you basically use.
Sir, to prevent post-dural headache, the hematoma formation is a good factor, no sir, to prevent the excess CSF leak. So a thicker needle will form better hematoma compared to thin needle. So thicker needle is. This is a question in AIMS.
Yeah, I'll tell you. I understood your point. You mean to say post-dural puncture headache is due to the leakage of the CSF happening through a small hole. अगर बड़ा needle डाल के करे तो जरा bleeding होता, वो clot हो जाता और seal हो जाता. Please give one big clap. One big clap. No, doctor, that is important. Ultimately, you need to be logical, though your logic is wrong. Doesn't matter. But you logically thought, I am very happy. It's like a naked king parading. Everybody said out of hypocrisy that a king has beautiful clothes. Only one small child said, no, there are no clothes, you are all bakwas baat kar rahe. So that is what is all about intellectual, but that is not the fact. We should not do it that way. Post-dural puncture headache को prevent करने के लिए there are 7-8 maneuvers. One of the maneuver is that not suppose if it happened due to excessive leakage, then we will basically put an epidural patch, but not induce a hematoma and then use it for here what you call sealing. So that's the point. Good. Then attention deficit hyperactivity disorder. What is except about it, doctor?
Delusion.
Beautiful. Hyperactivity, impulsivity, inattention, they are all the part of the criteria. Bipolar depression, what is except? Late age of onset is not a feature. 1/5 of people who are having bipolar disorder, mostly those with bipolar 2, they have the symptoms which wax and wane with the seasons. And atypical features are more important, especially in the case of the bipolar type 2. Type 1 and type 2, you need to know the all differences, and I leave the criteria for describing them. Now doctor, which is not a defensive mechanism in obsessive compulsive neurosis? Give me one confident answer. Conversion. Anybody said isolation? Ramakrishna, you are our authority. You said isolation? Yeah. You also say D? Something else? Undoing. Reaction formation. Are you able to see something else? Then that becomes a proper hallucination. So doctor, conversion is not included. Remember, isolation, undoing, reaction formation, ambivalence, magical thinking, they are all the part of obsessive compulsive neurosis defense mechanisms. All these are the somatoform disorders which is not included in that. Give some confident answer. 104?
C sir.
Conversion?
Amnestic sir.
Amnestic. Very good. You have a list, doctor. Conversion, somatization, hypochondriosis, body dysmorphic syndrome, pain disorder, they are all included under the somatoform disorders is what need to be basically remembered. Okay. So, what is the somatoform disorder basically? You have all the physical symptoms which look like a real disease or an injury, but really you don't find on clinical examination any organic physical finding. Cluster B personality disorder doesn't include anancastic, antisocial you want to say. Any other answer? Rama, what is your answer? Anancastic. Nafis?
D, antisocial.
Antisocial you think?
Antisocial.
Predominantly you all think? Okay. You can't help it because cluster A, B, C, D there is a big classification. Dots treatment ka another classification. HIV needle prick ka another classification. Life is all classified version. Paranoid, schizoid people are cluster A. They are called odd or eccentric disorders. Dramatic, emotional, erratic. Good teacher should be a cluster B ideally. So histrionic, narcissistic are all class B. Avoidant, dependent, obsessive, compulsive are all cluster C. Ultimately in medical college we have cluster C teachers and cluster B students. There is a big dissociation. If the teacher is cluster B, fine. So ultimately doctor, in Shadi.com what will you look for? Proper clustering should happen. If the matching cluster if you don't meet, then there is a huge chance of cluster conflict. Cluster headache can be there, that's right. Right. So obsessive compulsive and anancastic personality disorder are otherwise called obsessive compulsive personality is a class C. Now doctor, what do you use in the case of the MRI doctor? I am very happy to see about 50 plus viewers online and many more in all our centers. Yeah, what is your answer? Proton. Proton, that's a very simple question. Raju? Raju is there inside? Can call. Yeah. Okay. Which is a feature of mammogram which suggests malignancy?
C.
Speculated microcalcification. What is photodynamic therapy? Laser therapy.
C.
After sensitization, that's right, C. Interstitial lung disease, which is the investigation? HRCT. Air bronchogram? Consolidation. High osmolar food within 15 minutes is basically early dumping. Steatorrhea is due to distal ileum. We are tired of this distal ileum. Everything is due to distal ileum, nothing is due to jejunal. Now, which condition may radiological features are more severe than the clinical features? Matlab clinically patient happily lying down in the bed, but the radiologist is jumping, ye hai, wo hai, bolke. What is the condition?
C. C.
Very good. If you do barium follow through, strictures, lot of us we will be found to have them, but we will be eating everything comfortably more than the radiologist who is diagnosing it. So that is a whole problem. Too sensitive in picking up the strictures is what need to be remembered. Which finding represents the greatest procedure risk if you are evaluating for cholecystectomy? अगर ejection fraction 25% है तो अगर put him on OT, that's the best way, silent way to kill, anesthetize and kill the patient. Then the patient requires cholecystectomy. Pre-anesthetic check is unremarkable. What is least helpful? we all send routinely TLC, but TLC doesn't have any prognostic bearing or any importance. Huh? You want to say D, continued intake of antihypertensive on the morning of diuretics are? For a history of intake of diuretics for hypertension? No, diuretics may alter, okay, they can alter the sodium and potassium affecting anesthesia. That's the reason it is still useful.
How come it's useful, sir? If it is entering
No, the history of continued intake of antihypertensive, no, 1 minute. No, we did not say diuretics, correct doctor, history of intake of diuretics was there for the hypertension. Pre-acidic check is unremarkable except for the history of intake of diuretics for hypertension. The least useful step in perioperative anesthesia management is you need to continue the antihypertensives on the morning of surgery. You should not stop it. But doing a TLC on the morning of surgery has no meaning. That's a point of interest here. Okay. ये तो purely game of luck. बोलो. But a standard question. This is as standard as entrance. A or D?
D.
Who said D?
Because it's the safest anesthetic.
Huh?
Safest local anesthetic, Prilocaine. So I put it for the maximum ml.
That's the reason you kept maximum ml. Oh, good logic. I think logically driven right answer. Earlier was a logically driven wrong answer. Doesn't matter. So, Prilocaine, actually it is 400 mg lignocaine. Prilocaine is 400 mg, doctor. So you can give 20 ml 2% or 40 ml 1%. If examiner give 20 ml of 2%, what will you do? Because 20 ml kam hai, isliye main nahi leta hu. So, but anyway, you need to remember these dosages, which is important. Good. 3 hours after thyroidectomy, patient begins to bleed. What is it called as? Very good. Reactionary. Primary means?
During operation.
During the surgery. Secondary is due to infection. A clenched fist clot का size क्या होता है?
D sir, 500 ml. 500 ml.
पक्का?
500 ml.
Ram Krishna is confident. He has made a lot of patients to bleed. Our nurse Mary is confident in teaching. When we go to surgery theatre, the oldest nurse will tell a youngest medical student about how much swab weight is equal to how much blood. Right, doctor? Something else also the OT nurse will teach you. What is that? Most important lesson a OT nurse will teach you. How much to incline while doing assisting surgery. If you incline too much, you will catch back pain. So in fact, if you don't obey her, she may tap your back. Next time, if you incline a little more than the angle which I prescribed you, so I am going to pinch you, is what she will tell and teach you. Another very important lesson she will teach is how tightly you must hold. As a medical student, when you first assist the surgery, you will be pulling it like a rope. If your obstetrics assistant asks you, please assist me, hold the blade on the other side for the uterus, you will be pulling as the uterus will come out. So how much tension you need to pull also will be taught by the OT nurse. 60-year-old 60 kilo man with cholangitis with 1250 ml urine output. This shows how well you have done your intensive care unit housemanship. Jaldi bolo doctor.
C sir, C 4.5.
Superb. 4.5 is thought a Java ho jata. I'll tell you, calculation is like this. Urine loss 1200, insensible loss 1 liter, fecal loss 250. Generally combined become 2500. In a jaundiced patient you need to overestimate rather than underestimate. That makes it 3000 to 3500 ml, the most appropriate answer. Keloid versus hypertrophic scar, you need to be quite sure, doctor. Give us some confident answer. Huh? They are not different histologically, they are same, but in their clinical behavior they differ. That's the point. Skin suturing, what is the acceptable technique out of all this? C, I am listening, somebody saying C. The knot, the suture is cut a centimeter or so away from the knot in the stitches. Wound with minimum tension, that is very important, close to wound. Insert the needle at 90 degrees to the skin and pull the knot to the side is considered to be the important principles. What gas will you use for minimal access surgery, doctor? CO2. Cellulitis. This question wrong answer. You need to revise.
Streptococci. Strepto.
Superb. Staph is abscess, strep is cellulitis. Because only staphylococcal has an A with an A in the abscess. Now coming to diathermy, what is accept? Bipolar may only between the two poles only the tissue will be damaged, not extensively. Between the two electrodes. Hydrocele in filaria, do you want to do it, treat it specially unlike the regular hydrocele? No. That's the reason excision of the hydrocele is considered to be the management of choice. Hirsute, young male who travels in the car. Pilonidal sinus is very, very common in those who are very hairy men. Huh? Now, what is least suited for day surgery? सुबह करके शाम ऑफिस को जाओ, कब नहीं बोलते? C you want to say? Sharat's answer is C. Hafiz Bede, आपका आंसर क्या है?
I wrote it D, sir.
D, 21-year-old undergoing mesh hernioplasty under local anesthesia. Local anesthesia. If you do hemorrhoidectomy under spinal anesthesia, what are the complications which can occur, doctor? Urinary retention. He can't go with a full bladder to the assembly. You have operated on a MLA. That day assembly is in session, doctor. VIP patient management is little different. It is there is a Bailey and Lowe volume 2, specially meant for how to manage VIP patients. We will tell doctor सुबह surgery होना, शाम पे मैं जाके participate in voting in the assembly. Will you send him? You will tell him there will be urinary retention. No problem, Foley डाल के भिजाओ. I am ready to go. There is additional sympathy for the patients, for the voters. So that's important. Next, partial thickness versus full thickness. What is the difference? Huh? Nafees, आपका आंसर क्या है? Quick answer. No. You go more wrongs, we are happy. जल्दी बोलो. हाँ. Ramkrishna, yay. That's good. Basically, a partial thickness graft will leave all the skin adnexa, like the hair follicles and sweat glands, is what you need to remember. A calculation on the burns without that Sunday brunch is not full. What is your answer? Huh?
D.
58 to 65. Head 9, torso 36, left upper limb 9, right upper limb 9, total 63. Regarding trauma of the spleen, what is accept? Huh? You said D? B, that's right. So basically only a few children will develop overwhelming post-epilocal infections. In fact, nowadays what is the trend? Give a pneumovac before surgery and then do splenectomy. After 24 hours after thyroidectomy, if there is a hyperpyrexia, tachycardia, what is your diagnosis? Huh? Hypothyroid storm or hyperthyroid storm? Thyroid storm. So there is a reason what you need to do. Antithyroid drugs, dehydration, Lugol's iodine, everything is given, not antibiotics. This is a beautiful question, doctor.
Excuse me, sir. Are the steroids given?
Huh? Happily given. Why? Huh? Why this Colavari D? Oral Lugol's iodine and steroids and intravenous sodium iodine, all basically to do what, doctor? To prevent conversion of T4 into T3. Peripheral blockers of the thyroid activity. All these drugs are. Medullary carcinoma of the thyroid, what is except? Huh? Lymph node metastasis are common. Who said uncommon? Ultrasound shows gallstones, doctor. That time you found one adrenal mass, 7 to 8 centimeter in size. It is a non-functional incidentaloma. What do you want to do? Huh? C. Basically, you need to know size criteria. If you don't know, only luck.
Sir, 6 centimeter is the cutoff to differentiate between benign and malignant, no, sir?
There's auditory hallucination in the mind.
No, sir, it's
More than 4 centimeters in size should be resected.
no, sir. I'm sure, sir. 6 centimeter.
We are doubly sure, doctor. We came prepared to the class. Right? So more than 4 centimeters. Right? 6 centimeters बहुत जगह आते. Toxic mycocolon 6 centimeters. What are other 6 centimeters?
CBD.
5.5 is
CBD diameter.
abdominal aortic aneurysm.
CBD 6 mm.
So 6 will be a good auditory hallucination. Don't be mesmerized by it. Now, doctor, this funda everybody know. Don't give beta blocker first, give combinedly or alpha antagonist first. Now, 25-year-old bloodstained nipple discharge. No lump is palpable. What is the least thing that you want to do for this patient? Huh? For a young, sweet-looking 25-year-old female, even if it is breast carcinoma found also, you don't want to go for radical mastectomy. That's a very important point to be understood. Inflammatory carcinoma of the breast. What is accept about it? Huh? Give some confident answer.
D, sir. D.
That's right. Pregnancy makes it to increase in size is what you need to remember. Both mastitis, inflammatory carcinoma are more common in pregnancy. Mediastinal lymph node is 1 to 2 centimeters. हाँ ये बताओ क्या करना चाहते हैं आप?
Sir, I've read mediastinal lymph node. It's not mentioned whether it is ipsilateral or contralateral. If it is ipsilateral, it goes into.
बोलो Nafi's recommendations of malignancy management. De Vita in his graveyard in Italy will be listening. Yeah, please tell. De Vita is a top book in medical oncology. Yeah, but please.
If it is ipsilateral, then it goes into N2. If it is contralateral, then it goes to N3. If N3 is there, then we can't. It is a contraindication for surgery. So I didn't go for surgery because it's not in the mention.
Ultimately, where did you go? What is your answer?
Chemotherapy.
Chemotherapy. Okay, good. I mean, the point is, in pathology, they write a very good statement in Robbins' pathology. It is more irrational to expect the humans to be rational. So, that way, disease processes are quite irrational. They don't listen to what Nafis has prescribed, but doesn't matter. There must be some basis for what we recommend actually. That is the correct tempo one need to have. Nodes smaller than 1 centimeter can be presumed uninvolved. Larger than 2 centimeter are presumed to be involved. 1 to 2 centimeter, which are you are not sure whether she will agree to accept the rose or don't accept the rose. What will you do? You need to propose and run away. So they require mediastinoscopy, 1 to 2 centimeter ones. Dirty question. Who will remember lymph node size पे क्या
What
करते?
will we know, sir, if we do mediastinoscopy?
Huh?
What will we know more than?
Biopsy, doctor.
It's already given. It is squamous cell carcinoma, no, sir.
Of the lung has 1 to 2 centimeters, no? Has 1 to 2 centimeters mediastinal lymph node. लंग का कैंसर वहां गया या नहीं गया, साइज देख के कैसे बोल सकते? कुछ डेफिनेटिव करना पड़ेगा ना. नाउ executive undergoes health checkup. This is another common question day in and day out as a cardiothoracic surgeon you will be doing. Shahid, आपका आंसर क्या है इसका? Shahid is our already doing post graduation, so already extra common sense he might have acquired in the short tenure. Post graduation is all about that. Beautiful. 50% stenosis of left main stem is indication, not LAD. Intra-arterial thrombolysis mein what is not used? Fogarty. Fogarty is used for embolectomy, not basically for intra-arterial thrombolysis. Regarding liver, what do you know, doctor? It is not entirely covered. Some part is bare. What is that? Bare area. Most common cause of ischemic contraction is supracondylar. Avascular necrosis is Talus. Barlow is CDH. Ramesh Singh is fat embolism. जल्दी फटाफट इसका डिस्कशन का जो भी जरूरत नहीं है. Osteosarcoma is
B.
Bone marrow biopsy not required. This drop is
Radial nerve.
just to make you happy that you also know orthopedics. Dinner fork deformity is
Radius.
इसमें अल्लाह आंसर करे तो you can come, we'll give free coaching. Now osteosarcoma, this is a good question.
Metaphysis.
Metaphysis. Floating knee is, where is it floating?
B. B.
Femur tibia combined fracture of the shaft will lead to knee to float anywhere it wants. Simple. Workman's ischemic contracture is supracondylar. What is not leading to angle closure? Small cornea leads to, not flat cornea. Shallow anterior chamber, small cornea, short axial length, anterior location of iris lens, they are all the predisposing factors. Any alternative answer? Flat cornea is not implicated, is it?
Sir, actually all are
No,
correct.
you mean to say flat will make it closer to iris, sir?
Yes, sir. All are correct.
We'll check this, we'll check this. Bitemporal hemianopia, pituitary, glaucoma, bronchial asthma, timolol. Then thesis bulbi is
Sir, levobunolol is also non-specific, no, sir. Non-cardiac. Levobunolol is also non-specific beta blocker, no, sir.
it is a non-selective beta blocker, okay?
Then why should we only go for timolol? Why not levobunolol?
Non-selective beta, timolol is it is a non-selective beta blocker.
Beta 2, sir.
Betaxolol was there, eh?
Yes, sir.
Patient of glaucoma bronchial presents to the emergency with the status. So what predisposed to status?
Anything non-selective. So it can be either timolol or levobunolol.
Non-selective, sir.
Timolol is the most common predisposing factor, but you said levobunolol, eh? We'll check that about levobunolol.
Sir, Betaxolol?
Thesis bulbi, what's your answer? In fact, you have a decreased intraocular pressure. Now, doctor, pituitary tumor causes a repeat, okay. Intact cornea, Neisseria gonorrhea. Ovulation without release of ovum? Ovarian pregnancy. Accommodation is maximum in
A.
young children,
years,
hence
5
you need
years.
to use atropine ointment. Painless loss of vision is
C. Cataract. 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 A and C, sir.
Will developmental cataract, which lot of people will be having, lead to loss of vision? Lot of us will have developmental cataract if we
No.
check our eyes.
There is no.
I'm not
pain,
talking
sir.
about senile cataract. Vitreous hemorrhage is basically sudden painless loss of vision. Maybe if we add that sudden also, answer will, I mean question will be more complete.
Question is not
Huh?
correct. Question
Sir,
not.
optic atrophy.
Optic atrophy is included not in the painless causes. Secondary optic atrophy due to any raised ICT, painful or painless? Intraocular tension. Okay, anyway, there is a list, doctor. Painful, painless. उसमें जरा देखो. हाँ? Aqueous humor versus CSF. Huh? High ascorbic acid. Catch notch? Huh? 2 or 4?
2, sir. 2. C.
If you answered wrong, ENT और जरा लगा के पढ़ना पड़ेगा. हैं? Then traumatic facial nerve injury, what do you want to do? No role for any
Decompression.
conservative management. You need to do decompression. Malignant retinitis externa,
C.
pseudomonas in old diabetic. ASOM in children,
B. Streptonemo.
strep.
Pneumo.
Mastoid which erodes the outer cortex. Huh? Mastoid infection. Subperiosteal abscess typically. Most common tonsillitic.
Follicular.
Follicular, very good, that should be the answer. Rarely only Ramakrishna, if you tell confidently, we know that only those questions you answer correctly. Right, wrong? Let's answer right, answer it. Now, skull base,
Rhinorrhea.
huh?
Rhinorrhea.
Rhinorrhea. Actually, some students have expressed, sir, इतना tough मत लगाओ, for why you are so cruel. जरा एक 120 क्वेश्चंस इजी दे दो, आप जितना सैडिस्टिक रहना, रिमेनिंग 80 क्वेश्चंस में कोशिश करो. दैट्स आल्सो ए पॉइंट, राइट? सो दैट अल्टीमेट फेट इज बिटवीन 120 to 160. Actual entrance also is like that. Then why we need to give more than 100 question stuff? We should not ideally, if we want to conduct a good mock test. So that is the idea. But at least now you should get 150 plus before you say I am ready for the entrance. If not, you still have 2 months time to prepare, doctor, be very sure. 15-year-old progressive hearing loss, no discharge, conduction gap of 40, absence of acoustic reflex. What do you want to do?
Sir,
Tympanoplasty with a hearing aid.
stepidotomy.
Huh?
Stepidotomy.
वो भी करना पड़ेगा because you have a bone conduction gap.
Sir, absence of stapedial reflex, acoustic reflex is otosclerosis. The diagnosed first sign of otosclerosis. And on top of
In this case, we are not entertaining otosclerosis as, are we entertaining?
family history is there.
Family history of significant similar problems are there. Okay.
So it should be stepidotomy, no sir. Why should we go for tympanotomy? Tympanoplasty.
No history of discharge. Hearing loss for progressive hearing loss for the past 1 year. It is typically a female pregnant during pregnancy developing a hearing loss, or a female patient
Then what is
in a
the
reproductive
diagnosis?
age group.
What is the diagnosis here, sir?
It's more looking to be. Do you entertain possibility of otosclerosis in this? Okay, we'll review this. What is the logic behind it? Young's operation is for atrophic rhinitis. Very good. Then atrophic dry nasal mucosa, woody hard.
B. Rhinoscleroma.
Good, rhinoscleroma. You don't need Graafian follicle rupture history for? Hussein, what is your answer? Huh? If you have an emergency telephone, you will not tell them. जरा जाके आपका ग्राफियन फॉलिकल का जांच करके डिसाइड करो बोल के. Remaining things you will do. Graafian follicle rupture is important for fertility control, timing the intrauterine insemination, etc. etc. Urogeroidal prolapse, what is except, doctor? Huh?
Hernia. C.
Inguinal hernia is not a manifestation, but all the remaining things are the true statements. Heterotopic pregnancy, what is except about it? Ectopic, IVF, GIFT, in all the scenarios you can have one intrauterine, one extrauterine. Now common indications for the trial of labor doesn't include?
C. C, sir.
Huh? Nafis, आपका आंसर
C.
क्या है?
Sir, I read it as non-reassuring fetal heart sound for C and I kept it that, sir.
C, sir. Answer.
You kept answer as C.
C.
Okay.
C.
Any other answer? Will you do in a mid-pelvic dystocia?
Okay, sir. No problem.
Trial labor.
Yes, sir.
Yes, if it is only in the upper part. If the
Mid-
CPD.
Mid-pelvic is mid only. There is no upper mid, lower mid, middle mid. Mid-pelvic and outlet contraction is a contraindication to trial labor. Huh? Then complicating factors like post-maturity, post-cesarean, preeclampsia, etc. All these can lead to preterm labor except? Huh? Uterine anomalies are known to lead to? Not all, but a good number. Cervical incompetence, bacterial vaginosis, uterine anomalies, they are all known. It is not an increase of IL-6, rather decrease in the IL-6, which is implicated among the cytokine factor. GDM is associated with all these things except gestational diabetes. ये आंसर जो भी करेक्ट आंसर करेगा, ग्रेट. व्हाट इज योर आंसर?
D.
डी.
Sir,
A. Excellent. Please give big clap to all the guys who said A. Loud clap. 176. Even Sudhir is answering it as D. Dinesh is also thinking it as D.
sir, multiple pregnancy is not common in gestational diabetes, no sir.
Multiple?
Multiple fetus is not common in gestational diabetes.
See, there are certain definitely proven facts. There are certain facts that are found to be not present and वो भी proof है. Y has no meaning in this, but GDM में I leave the literature for you. What are all the hazards? Macrosomia, polyhydramnios, birth trauma, they are all in the included list. But fetal malformations have no increased risk. I am not talking about the women who has diabetes before becoming pregnant and became diabetic. I mean, whom you found. There is a difference. No, gestational diabetes is induced by the gestation, not the one who is diabetic earlier who became pregnant. वहाँ तो होगा, not GDM. Fetal anomalies. Huh? See, they found pleural pregnancy more commonly found in the people who are found to have GDM later. That's the idea. What is the other thing? Renal agenesis is known to have an association. No, it leads to oligohydramnios. That's a different story. We are talking about incidence per se. Huh? Okay. What is wrong about intrahepatic cholestasis, doctor? Give one confident answer. Huh? A, C,
C.
D. What's the answer, doctor? D, eh? Huh? Any other answer? Hussein?
C. C, sir.
C?
C. C.
Nafis, what is your answer?
My C Raga, sir.
Ultimate judgment. Jaldi bolo. Our online classmates from Karimnagar is proposing D. PS is proposing A. Dinesh is proposing A. And he says it is the viral hepatitis most common, not the intrahepatic cholestasis most common cause. You also agree with what Dinesh said? That's right. There is one MDR3 which is important for the canalicular excretion of the phospholipids. Mutation of that is very much implicated in the intrahepatic cholestasis of pregnancy is what you need to appreciate, doctor.
Yeah.
In all this you find pregnancy associated breast cancer except
C.
lactating adenoma is a benign, not a predisposing condition. What decides the outcome of IVF except? Huh?
Sir, I have written A because HCG.
Because that is the correct answer. Type of gonadotropin used is not having any bearing.
No, I have written D because
Then there is a because for that. Yeah. Tell me.
No, HCG is better stimulant. So in IVF, it's always better to get more number of ova, more ovulation, so that there can be more number of fetuses which can be given, so that there can be more success.
That's fine. But then why did you not answer A based on that? But you did not give me a answer. Why you chosen D?
Number of embryo transfer, I agree with that, sir, because more number of embryos implanted, even if one fails, something else will remain. Adequacy of luteal phase, that's for sustenance. And the left out is only D, sorry.
See, doctor, there are two types of coffee. Instant coffee, filter coffee. Spermatogenesis in the males is like instant coffee. Oogenesis in female is like filter coffee. As the woman is aging, her eggs also become like Scottish whiskey. 30-year-old Blue Label Johnny Walker, like that. So it become an old 40-year-old egg. Man is not like that. He is like an instant coffee. 2-3 days back, the journey started for the sperm. He is enthusiastically waiting. Who is my recipient? So that's the reason age of the woman has a bearing. Ultimately, whether she can. That's the reason. Now, what is the nutrient, doctor? Egg donors. You didn't hear? Egg donors. If a 42-year or 43-year-old woman comes for IVF, doctor, what will you tell? Sperm of your husband, egg of your sister, younger sister, who is at least 5-6 years younger to you. We wanted to combine and match. So the main reason is age of the woman has a bearing on the IVF success very much. Now I know what Nafis is going to ask. If the egg is there on ultrasound, can we take in a 43-year-old? That is also important. Even if egg is found and you are able to pick it up, the ultimate success of that old egg to bear that penetrated sperm's DNA will be less compared to a younger egg. So that's the idea. Now, doctor, endometrial carcinoma, what is accept about it? Give a confident answer, doctor.
Yeah.
Is cervical glandular involvement has a bearing? No. DNA ploidy, steroid receptor status, BCL2, oncogene, they all have got a bearing is what you need to basically remember. Caesarean myomectomy, what is accept about it, doctor, for you to do? Fibroid, if it is in the upper segment you don't need. If it is in the lower segment, encroaching, not approachable, then you need to do the caesarean myomectomy.